Hey everyone, Dr. Luke Peterson here, physical therapist with the Knee Replacement Therapist. In this episode of the Knee to Know Show, we're going to take a look at the rehab and recovery timeline and the healing timeline after knee replacement surgery. Hey everyone, so today we're talking about your recovery and rehab timeline after having knee replacement surgery. And there's really this range of what we expect to be kind of normal or average. There's these different guidelines and benchmarks that we have. But before I dig into it, I want to make sure I put out that disclaimer that everyone's going to heal and recover at their own rate. There's going to be people who recover really fast and feel great. There's going to be people who take a lot longer, and that's perfectly normal, perfectly okay. There's kind of this spectrum of what we expect to happen, what we expect to be normal, and you may fall anywhere in that spectrum. So first thing I want to say is that, but let's dig into a little bit more of kind of what to expect and what are some of the guidelines when it comes to your recovery and rehab timeline. So you're going to have surgery. For some folks, you may spend 1 day to maybe 2 or 3 days in the hospital. For others, you may be discharged that same day as surgery. Discharged from the hospital, you may have an outpatient procedure. Now, a lot of folks, you're potentially going to have some assistive device early on. So you may have a walker, you may have crutches. And usually then if you have one of those devices, you may progress then to a cane and then to using no assistive device. And usually this takes, it happens within the first couple weeks, 1 week to 2 weeks, maybe a little longer for some folks, maybe a little shorter for others. Some folks, they may not even have to use a walker. They may go just straight to a cane, or even some may have no assistive device that they use at any point. So that's something to keep in mind as well. Now, early on, that same day that you have knee replacement surgery, they're going to get you out of bed. The physical therapist is going to come see you, and you're going to start moving, and you're going to start walking, and you're going to start doing some early exercises to get your knee moving, to help prevent blood clots, things of that nature. So right away, you're getting started with therapy. Now, once you go home, most folks will go home from the hospital after surgery. There is a percentage of people who will discharged to an inpatient facility for a variety of reasons, but the vast majority of individuals, especially if you're a little bit younger, a little bit healthier, are going to go directly home after surgery. So something to keep in mind. When you're home, you may have some home physical therapy or home health services. These services are usually for individuals who have difficulty getting to an outpatient facility for whatever reason. Maybe it's you don't have a ride. Maybe it's just really difficult to get from where you are to where the facility is. There's a variety of reasons. So some people may have home health services for a week or so after coming home. Others individuals, you may start outpatient physical therapy as soon as you can get in for an appointment. So outpatient physical therapy is going to usually start within that first week, if not the second week or so after having knee replacement surgery. And early on, you're really just trying to manage all those acute symptoms of having a knee replacement. So you're trying to manage the swelling, manage the pain. Of course, you have pain medicine, but there's also non-pharmacological pain management strategies, icing, compression, things of that nature. And you're just trying to get things moving. You're starting to get your range of motion back, your knee straightening, your knee bending, and early on starting to build muscle strength and get some contraction of those muscles. And that's early on. And you're going to be fatigued, you're going to have a lot of pain, you're going to be coming out of the effects of being under anesthesia and having a significant surgery. You're going to be taking pain medicines that are pretty strong and may have some unwelcome side effects, unfortunately. So there's a lot going on and your body's going through a lot. And that's usually that first 1 to 2 weeks. You're really just, trying to get by and do what you can to let your body heal and recover. From that second week to third week, on to maybe, we'll say 6 weeks or 8 weeks or so, this is when you really start to progressively going forward and improving with your physical therapy, with your management of this knee replacement. So we're continuing to increase your range of motion. We're continuing to increase your strength. We're increasing your function and your mobility and your walking and all of these things with that goal to get you back to doing your daily activities, feeling good, doing the things you enjoy and the things that you like. Now, anywhere from maybe that 6-week mark or 8-week mark to, we'll say, 12 weeks. Again, remember, there's that variability, so everyone's going to be a little different, but this is just kind of an average or a guideline. We'll say 6 weeks to 12 weeks. At that point, you're really trying to make that transition from being in physical therapy, just trying to get that motion, trying to manage the pain, manage the swelling, to being able to do the functional activities and the day-to-day activities that you enjoy and that you want to do. That may be your career, your work, that may be just leisure, social activities, whatever that may be. And of course, just your daily activities, being able to do the things you need to do to take care of yourself as a human being. So that's kind of that 6-week to 12-week mark, trying to make that transition where eventually you're going to be discharged from physical therapy and you're going to be managing your knee replacement, your recovery on your own. Now, just because you may be discharged from therapy at 8 weeks or at 12 weeks or maybe 16 weeks for some folks, again, there's that variability, then that doesn't mean your recovery is done. You may be, if you had a good course of rehab and recovery, then, we're hoping that you're at that 80%, even 90% healed and feeling better and feeling back to normal by the time you're discharged from therapy. Some folks may be less, some folks may be even better, but hopefully you're in that 75 to 80% range of healed and feeling back to normal. Of course, this is a subjective measurement. There's no real way to fully measure this, but somewhere in that range of recovery and feeling better. And then after that, after you're discharged from therapy, so we're talking 3 months out from surgery, maybe 4 months out from surgery, your recovery, your healing is going to continue. You're going to continue to get better. You're going to continue to get stronger. You're going to continue to have decreases in pain and decreases in swelling and discomfort and improving your ability to tolerate activities. So, I talk to people about when exactly do I feel normal? When do I feel that I'm fully recovered? When do I feel normal? Well, this is going to be probably the most variability. So for many folks, it may be around that 6-month mark, 6 months after surgery. For some folks, it may take up to 1 year or a year and a half till you really feel like you feel better, you feel recovered. And then for some, it may be 2 years, or it may be more than 2 years. It may be 3 years. It may be even more. That's few. That I would say is the minority of folks. A lot of people are going to feel a lot better by that 6-month mark, or at least by that 1 year to 2 year mark. But there are some individuals who it's going to take more than 2 years even to really feel better and recover. And of course, there are a few people who never truly do feel fully recovered. There's people who have lingering symptoms, stiffness, discomfort, and might have a negative outcome from surgery. Unfortunately, that's a very few. That's a rarer occurrence, but of course, that's something to keep in mind as well. So what this means as you heal, as you recover, as you go through all this, there isn't necessarily going to be a point where you say, I have no pain, I have no symptoms, I feel great. You're going to continue to possibly and probably have some lingering symptoms throughout this time period. You might have mornings where you wake up with a ton of stiffness. You may have days where you do a little bit more activity or a little more walking and you just feel achy and some pain in that knee. And this is perfectly normal. You may have swelling still. This is perfectly normal. I tell people that the rehab and the recovery, it's not a revolutionary change. So you're not going to find one day where you're just going to wake up and you feel 100% better, never have pain again, never have stiffness, never have swelling, never have any difficulties again. It's an evolutionary change. It's a slow change over time. So slowly over time, as you rehab, as you recover, as you try to stay active, you're going to have decreases in frequency and also decreases in intensity. So decreases in frequency and intensity of pain, of swelling, of discomfort, of stiffness. They'll decrease slowly over time. Some people may get to the point where they feel hardly any. Some people may have some lingering symptoms, but overall feel positive and feel happy that they had knee replacement surgery. So that's the timeline of your knee replacement recovery, your knee replacement surgery. If you're someone on here who's trying to just see when can I drive again, well, again, it varies. Some people as early as 4 weeks, but you want to think more in that 6 to 8 weeks. When am I going to get back to work? Well, if you have a more sedentary job, maybe 6 to 8 weeks is a good goal. If your job's a little more physically demanding and active, you may think more realistically in that 10 to 12 week mark. Of course, everyone's going to be different depending on the demands of your job and your profession. Other than that, that's an overview kind of guideline of what to expect with your recovery and rehab. It's a marathon. It's not a sprint. Even after discharge from physical therapy, you're still going to have to manage your knee. You're still going to have to go continue to heal, continue to recover, and continue to get better. It's an evolutionary change, not necessarily a revolutionary change. Thank you very much for watching, and take care.